Welcome back, guys. Today we're going to talk a little bit about the ward round and documentation. Again, I like to say that please, if you have any trouble, consult your senior and always use some common sense. In terms of documentation, it's probably the most important thing that you do throughout your day. Now, why is it important? Because it's really the medical legal documentation. So, for example, if it's not on paper, then it didn't really happen. It's there to protect yourself and also to protect the patient. The way that I like to tell my intern residents to document in the notes is the simple SOAP system, and that is subjective, objective, assessment, and plan. So subjective is essentially we ask some questions on what the patient says. So for example, the patient says she's not having any cough, she's not having any chest pain, the bowel habits are going okay. The objective is where we normally write the observations and the clinical examination findings. Assessment or impression is we normally list a number of issues for the patient which may be active or inactive. So for example, Mrs. Jones might be here because of an acute coronary syndrome, but in addition she's got a few issues in terms of discharge planning. She's a little bit immobile, wishing to go to rehabilitation, etc, etc. And lastly, the plan. So the plan should be documented in a way that is clear. So normally I like to list the things that need to get done now, later today, and in the next couple of days, and in that particular order. 3 small but important things. Make sure when you're documenting, always put the date and time at the left hand upper corner, and also to write who was there at the ward round. So if your consultant was there, make sure that you write their name there. If your registrar was there, make sure you write their name. If you were there, make sure that you were right there, as well as include other people that might be on the ward round, including medical students and other nursing staff, if relevant. Lastly, probably the most important is legibility. As we all know, ward rounds can be busy, and it's very awkward to write standing up and holding a med chart, but try your best to write neatly, and it's always recommended that you use a black pen. Now whether you use a biro or fountain, that's really up to you. In my opinion, a biro is probably better for the internal resident because you're writing so much and it's less likely to run out, and it's less dependent on position. Whereas I think if you're a bit more senior, become registrar or senior registrar or consultant, you can move to a fountain pen, which obviously looks a lot nicer when you write. So I hope that was helpful, guys. I'll see you guys next time.